Hello everyone, good evening. Can you hear me? Okay. So we are at dot six and some 12, 13 people have joined so far and more are expected to join. I think we'll just wait for one more minute and then we will start. So just one more minute and then we start. All right. A very warm welcome to everyone. Thank you very much for joining. My name is Salik, and I work as a project coordinator with the organization Sangat. And I'll be making this presentation before all of you with my colleague Gauri. We'll hear from Gauri in a while. Um, I just wanted to have some housekeeping announcement before we start. One is a small request to all of you. If you can ensure that you keep yourselves on mute throughout the session, that would be very kind. If at any point you have a question or if you have a suggestion or you want to make a comment, you can use the chat feature. The another announcement that I have is this session is being recorded and we are recording it so that we can upload it subsequently and put it in the public domain. So that is a disclaimer that I have. We have blocked 2 hours for this session, 6 to 8, but we should be able to complete the session in 90 minutes or perhaps also in less than that. So those were the few announcements that I had before we begin. This is what today's session would look like. So following the welcome note, we'll give you a brief about our organization and our group. I hear who we are and what we do, so we'll talk about that briefly. Then we'll tell you the story about our project, Kinship, that is what it is called. We'll also share the findings from our project. And after that, we'll have some dedicated time for Q&A, remarks, suggestions, discussions, where all of you can come and unmute, raise your hand, make a comment, or use chat feature. And then we'll have a vote of thanks. So that is broadly the outline that we have for this session. All right, we go straight into the presentation. So a bit about our organization. So Sangat, the organization where we work and the organization where the project was hosted, is a 27-year-old public health uh, organization. Our head office is in Goa. It's a non-profit organization, but we also have offices in Bhopal, Delhi, and Pune. And this project team was based at Bhopal. Some of the areas around which we work or on which we work includes child development, adolescent and youth health, adult mental health, aging and chronic diseases, addiction, marginalization, and research ethics. What do we do? So we do community-based research, we do advocacy, we have capacity building initiatives. We also do public engagement and clinical services, especially in the realm of mental health. And we have won a couple of awards, couple of prizes that have been mentioned on this slide that you could see. At Sangat, we are a group of early career professionals who are interested in issues of marginalization, equity, and health access. Our group is called I Hear, that stands for Initiative for Health Equity, Advocacy, and Research. We work with diverse set of collaborators, funders, mentors, etc. And what we do, we also do participatory research, advocacy, and capacity building initiative, and we are all from different parts of the country. Most of us are based in Bhopal, and we work at the Bhopal office of Sangat. Some of us work from other parts of the country as well. This is one picture where our team, our IHEAR team is there, as well as a lot of our participant collaborators, mentors, well-wishers. And this is a picture that comes from a conference that was held in Delhi in May 2022. The focus of the conference was trans-affirmative medical education. So this is just one picture from that event that we had. All right. So that was the background. Now we go straight into the project that we want to, that we are here for, the project which is called as Kinship. So I'll start with some background, some context about this project. So all of us age, you and I, all of us, we do age. Aging is inevitable, but older adults or issues of older adults from the LGBTQIA plus communities is less visible. It is less visible in research and academia. It is also less visible in public or popular discourses. If you look at studies from other parts of the world, that is, if you look at non-Indian context, some of the issues that have been highlighted in the literature includes greater dependency on informal healthcare support, that is greater dependency of older queer people on informal, on formal healthcare support, and some challenges such as loneliness or depression that goes hand in hand with aging. Um, Now, yes, it has started. I see a comment in the chat. Am I audible? Can people hear me?
Yes, we can hear you.
Okay, all right. Now, when we say kinship, what we are referring to is not just how kinship is understood in a traditional sense, which is a relationship by marriage or by blood, but we are also expanding that definition to include chosen families as well. And as we approached this project, we approached it with the premise that kinship can act as a pillar of support in navigating some of the challenges that older queer people may experience, some of which I talked about in the previous slide. And basically, what we are doing is we wanted to hear the stories of older queer people through the lens of kinship, through the lens of the different kinds of kinship that may be there in their life and what role it plays. So essentially, bringing limelight, bringing focus to the lives of older queer people, but through the lens of kinship. That's the premise with which we started. Our funder, so this is a funded project, Williams Institute at University of California, had a global LGBT QIA plus aging seed grants program, and we had applied for funding there, and we were successful. And with that funding, our project was born. So what you see on the bottom right of the screen, that's the logo of the project, Kinship as in queer kinship. So that's why it begins with Q, and a background that we developed for this project. Moving to research question and method. So this is a research study. So the research question that we have, or the research question with which we started, was what are the different forms of kinship, their perceived meaning, and its significance in the lives of queer individuals who are aged 50 or above and who live anywhere in the urban India. It was a qualitative research study that used community-based participatory approaches, and we'll talk about that more in a while. We interviewed people who are 50 plus, who identify with the queer community and who live anywhere in the India. It was a one-to-one interview that we conducted, recorded, and then analyzed. Okay, I'm going back. Yeah. The project team, who we were, that is who was involved in this project. So that's me, Salik. We also had Varnika Priyadarshini. Varnika has a background in queer studies, and Gauri Mahajan. We'll hear from Gauri. Gauri has a background in psychology. Deepak Tugnawat, Anand Bhan, and Hari Kirtan Raghuram, all three of them are based at the Bhopal office. Deepak is a public health management professional. Anant has been working for very long in the area of bioethics and health policy. Hari Kirtan is a medical professional who is interested in public health and health equity. We also had a group of external collaborators who were working with us and guiding the team on this project. So Aqsa Sheikh, who's a professor at Jamia Hamdard, Shivakami, who's a professor at Tata Institute in Mumbai, Tata Institute of Social Sciences, and Satyendra Singh, who's a professor at UCMS, University College of Medical Sciences in New Delhi. So all three were our external collaborators and they have been guiding the team throughout. One of the first things that we did in this project, as this is a participatory project, was to set up a community advisory board. We set up a board of people who are from the community and who are in the age group that we are looking at. So that is the age group of 50 and above. And we have been getting a lot of inputs from our advisory board when it comes to, say, reviewing the study tool, when it comes to approaching people for interview, when it comes to interpreting the findings, etc. And this is a screenshot from one of our advisory board meeting, and you can see that this is our board, Chainika, Smriti, Sharif, and I think some of them are here in this meeting today as well. So we'll hear from them as well. We'll now proceed to how the study was actually implemented and what some of the findings are. I'll invite my colleague Gauri for the same. So thank you, and I'll be back soon.
Thanks, Alec. Moving on to the development of the study tool, we approached it by first going through literature that exists on queer aging, as well as work done in queer spaces in India, especially. As a team and along with our advisory board members, we formed a questionnaire of around 22 questions, which covered topics such as relationships with biological family, experiences with partnership, with friendship, as well as the central question of what family or what kin might mean to people as queer adults. Along with this, we also prepared demographic sheets which covered information like their age, gender and sexual identity, place of residence, amongst other things.
Gauri, two people have said in the chat if you can speak maybe a bit louder, maybe you can hold
Okay.
the microphone closer. Yeah,
Is this better now?
yeah, much better. Yeah.
Okay, cool, cool. I'll hold it here. Um, in the process of reaching out to people, we adopted a purposive sampling method, which aimed to have diverse representation in terms of regions in India and also across gender as well as sexuality. We also use snowballing methods, so requesting people from the community and in our networks, as well as requesting people we interviewed to pass on the words and put us in touch with other people who might be interested and available to take part in the study. With all these methods, here is an overview of the demographic details of our participants. Um, on the left, on the map of India, the green dots represent each participant and where in India they were based in at the time of the interview. So, in summary, we have seven people from Maharashtra, four from Karnataka, three from West Bengal, two from Telangana, as well as one each from Tamil Nadu, Bihar, New Delhi, as well as Uttar Pradesh. So we aimed to reach geographically different parts of the country and try to ensure that the people we're speaking to come from different urban centers within the country. With respect to gender identity, 11 participants of the 20 identified as cis men, four as cis women, three as gender fluid, four as agender, and one as non binary. And for both gender identity and sexual identity, it was qualitative description so they could define it how they felt most appropriate. With respect to sexuality, 11 identified as gay, four as lesbian, three as asexual, and one each as queer, bisexual, and one person described it as beyond being labels. Um, at the time of the interview, 13 of our participants described being single, five in queer relationships, as well as two being in heterosexual marriages. This closes the demographics part of our study. Moving on to the findings of the study. We found that kinship amongst queer adults can be of three types primarily: families of origin, which include parents, siblings, as well as extended family, families of marriage, as well as procreation. Um, so, this would include spouses as well as biological children, as well as families of choice, which would include um, friends, partners, children, community members, as well as other forms of support that they might access. These forms of kinship also often overlap with each other and share ties across each other, and don't really exist in isolation, which we'll cover in the next few slides. When it comes to families of origin, relationships with biological parents shift and evolve with time. And warm and positive relationships are often hinged on acceptance of one's sexuality from the parents. This acceptance also often comes with time, as described by our participants, and many of them describe that one parent might be more accepting than the other parent. And acceptance also might change after the death of one parent. In cases where participants don't come out to their parents, they're often met with um, pressures to marry and then to have children, often having to give in to these pressures. And irrespective of acceptance from parents, there are expectations of caregiving on the individual as the parent ages. Many of them describe it like a job. The quote here also says, because right now, much of my life decisions revolve around my mother's health and her being okay. 2 years down the line, 5 years down the line, I don't know what the reality of my parent will be. Um, so this highlights the central expectation of um, caregiving in a queer adult's lives. If the individual has siblings, it's often highlighted that they might be expected to be the caregiver in the absence of a quote unquote normative family structure, where if their sibling has a spouse or if their sibling has children to look after, then it's expected that the queer sibling would be looking after the parents. Coming to siblings within families of origin, relationships in the present day are often varied in nature, with some people describing their siblings as their biggest pillars of support, while some participants describe being completely estranged from their siblings. Those with close relationships described a shared understanding of the world with their siblings and have similar values. In the quote here, a participant says, my youngest sister is my pillar of support. Today, I have an alternate family, and my alternate family is her family. We meet every Sunday and we are together. We have our lunches and dinners. She's always a part of us. And she feels that one of the major regrets in her life is that at the time when you needed me the most and I was so close to you, I never realized what you were going through. This also highlights how, as years go by, acceptance from siblings can go a long way in being support systems in their older years. Being close to their siblings also often translates to warm relationship with their nieces as well as nephews. Many of them describe their nieces and nephews as being biggest supporters, and feeling invested in them and finding acceptance in the younger generations of their families of origin. Watching them grow and being caregivers for them sometimes also is described as incredibly fulfilling for many people. Um, Moving to families of marriage and procreation, for participants that are either currently in a heterosexual marriage, divorced, or separated, relationships with spouses often vary. Some describe their relationships as a camaraderie of sorts, where they share responsibilities of childcare and having shared financial resources. However, being queer often impacts these unions. So, participants describe being unable to fulfill the expectations that come with being a bahu or a daughter in law, and the gendered expectations that come within the institution of marriage. Another participant also describes expressing their feminine side to their spouse. In the quote, they say, I told my wife about me enjoying cross dressing or kind of willing to express my feminine side. And then she said that she wants nothing to have to do with that. So that ended the conversation. So, acceptance from spouses can also be a tricky space to navigate for many of our participants. However, for participants who may be separated or divorced, they describe being cordial with their ex spouses as well. When it comes to biological children from heterosexual marriages, some participants describe finding acceptance in them. One of them describes it as their daughter being the only one who knows about it. Um, in the quote, they say, of course, she thought it was a one off thing and something that I do for the many corporate videos that I shoot. And I kind of told her that this is what I like, this is who I am. And she said, okay, fine, good night, I'll see you in the morning. And that was it. It was as simple as that, but there was a relief that I didn't have to hide it. So there is some acceptance from younger generations within families of heterosexual marriages as well. Um, our participants also describe th- uh, giving birth and within their marriage as being a mistake, and that it was more from the pressures of after the pressure of being married and then the pressure of having children, and they might describe it as a mistake. Um, some participants also expressed considering adoption as well as surrogacy, but expressed difficulties in accessing the same. It was more considered while they had a partner, and that they would like to share the responsibilities of somebody, of a child with somebody else, but didn't found it not to be accessible to them, whether through legal frameworks or financially. Moving on to families of choice, these are described as the primary forms of kinship in the lives of queer adults, and is the balm in the context of self expression. When it comes to friendship, it's described as the backbone of their lives, and what keeps them afloat in many ways. Friends are, in their words, all that we have, and they're their world. They have shaped individuals and have been consistent over several decades in terms of stability and effort put in to cultivate meaningful relationships. They're also sources of safety, being emergency contacts for dates, and life without friends is unimaginable. Friendships also sometimes um, are seen as consequential, where they're taking care of one another, being there for one another, as well as seen as sources of value as well as knowledge. And learning from friends is also seen as very important within the structure of chosen families. Um, Friendship also sometimes leads to warm relationships with friends' families of origin. One participant also considered their friends' parents as their real family, and used to take care of them, calling them every evening till they passed, as well as introducing partners to their friends' parents. In the quote here, a participant also says, that's all we have. Friends are the only ones who are so important for us. They're the ones who stand by us, who look after. I look after them, they look after me. It's just our friends. We give our life for friends. Who else is there for us? Friends is everything. It's the most important thing in our lives. Um, this kind of highlights the centrality of friendship and the value it brings to their lives. They also highlight that forming new friendships as you get older gets more difficult, given that social events seem to be catered towards younger queer people, or that older queer people already seem to have a set social circle, making it hard to form new relationships as one ages. When it comes to partnership, there's often an overlap with friendship, with people describing their relationships or partnerships as romantic friendships in many cases. Like with friends, partnerships are also built as well as sustained on trust, on shared values, and a commitment to support one another. Um, Reasons for breakups often involve marriage pressures on the partner, with some of our participants' partners being forced to marry, or migration and maintaining long distance relationships, especially before the internet was highlighted as quite difficult, as well as experiences of abuse within relationships. When it comes to dating, participants also describe feeling worried about finding partners as one ages and being seen as less desirable due to one's age. However, they also describe being sought out on dating apps, as age and financial stability are often seen as attractive. And anticipating loneliness is also a common experience for our participants. In the quote below, a participant says, I always wanted to be in a relationship. So, although I'm 58 now, I know that my chances of finding a partner are exponentially declining, but I still haven't given up hope. If I find someone, that will be amazing. So, hopes to have a romantic connection and hopes for partnership, especially within their age group, is something that's also highlighted in our study. Um, Coming to children, and children of choice are also valued in this kinship system. Many participants describe being responsible for younger generations in several roles. There's also a desire to want to nurture and want to watch something grow, whether it is in the form of a mentor, a teacher, a grandparent to their siblings' children, or an uncle or an aunt. Even for participants who didn't have biological children, they describe watching their children of choice grow and learn, as well as fumble and experience the joys and pains of parenthood in every way, and feeling proud of their children as well. Um, in the quote here, they say becoming like the senior guide or a mentor or a teacher or a parent becomes second nature, like you become a father figure. So even with my kids, I'm always giving them life lessons. So being a parent occurs naturally to me, but I don't seek, and I've never really seek to have my own child. I've never sought that. Um, a participant also describes their pets as their children, and describes their pet as their shadow who's been with them for so many years. And many participants also describe watching and nurturing life in plants as being incredibly fulfilling, and something that they enjoy doing. Um, um, Lastly, within families of choice, other forms that chosen families might take in the day to day lives of queer adults take the form of support groups, whether it's queer support groups, or on topics of mental health. They seek connection as well as acceptance in such places. Um, Other forms of chosen family includes house help as well as drivers, and having people that surround them in the day to day and are there for them in the day to day as being extremely important in their ecosystem. Many have also formed organizations and built families of choice with colleagues and friends alike. In the quote here, they say, from the heydays of the Council Club, I've felt that I've had a queer family. Because the very formation of support groups in the 90s was like creating a parallel family for yourself. Apart from my natal family and maybe a couple cousins, the biggest supporters have always been my queer community friends, some of whom have been my colleagues in organizations that I've worked in. And I can't imagine life without them. This highlights the central role of families of choice in queer lives and how support in the day to day may look different for queer people. With this, we finish the findings section of the presentation, and I'll hand over to Salik now.
Thank you, Gauri. Excuse me. So, If we try to locate our findings in some of the literature which is out there, if we try to compare and contrast with some of the literature which is out there, first thing to keep in mind is what we also highlighted at the start is that there are very few studies that have focused on older queer people in the Indian context. There is one set of studies that focus on psychosocial challenges and issues such as depression and loneliness is what they find, what they report in literature. And then they also try and identify some of the coping strategies which are out there. So, social engagement, spirituality, etc., which may act as coping strategies. So, that is one set of studies which are out there. The other set of studies that we have are studies which are looking at access to health, sometimes access to health in a specific context. For example, in the context of pandemic, um, how um, how does how did it affect queer community or older adults from the queer community's access to healthcare services? If we try to place our findings in the backdrop of these studies which are out there and which are focused on these specific issues, um, we also found in our study that loneliness, challenges of finding partner, ageism often prevalent on dating apps or dating platforms, and fear of dependency as one age was shared by several of our participants. But we also found that many of our participants have shared or have highlighted that they're very content in their independence, and they enjoy the support that they get from different forms of kinship, which are prevalent in their which are there in their life. It may not be an either or situation as well. Like you can be having a good set of friends and enjoy their company, enjoy the support that you get, but you can still be lonely, or you can still may want independence, a lot of independence in your life. So it may not be an either or situation. There may be nuances within it that may need that's something that we should keep in mind. Another thing to keep in mind is that many of our participants were actually in the role of caregivers themselves. That is to say that there were other people in their lives, parents or friends, who are dependent on them, and they were providing that role of caregiver, which Gauri also highlighted. So, in conclusion, kinship, including non traditional forms of kinship, is present, and often the non traditional form is more important, more vital in the lives of all the queer people. It acts as a source of meaning, and it can be of great significance in their day to day life. It's something which can also tie into inheritance, which can tie into health related decision making as you get old. When we say inheritance, it could mean wealth, it could mean property, it could mean belongings, resources of all kinds. One of our participants had developed a whole library of queer literature that he had, and it was his concern that after him, who is going to preserve this library, who is going to sustain this library, because the content which is in this library is quite important. So inheritance need not always be in terms of property or wealth. There are other kinds of things that may also deserve our attention. What we feel, because friends and friendship have played such important lives in queer people, a pathway should exist when it comes to choosing a kin for inheritance, or when it comes to nominating a kin for a health-related decision making. A pathway should exist in the legal framework. That is something that will help queer people in the age group that we were looking at. Since we saw that friends and partners do play an important role, one may actually need platforms that provide opportunity to form and nurture friendship, or to form and nurture partnerships. But it's also very important to think about what these platforms will look like and how these platforms will be. Because if it's a physical platform, then that can come with its own challenges, whether it is traveling to meet people, whether it is mobility related issues. So that is also something we need to keep in mind. If it's a platform that provides a physical engagement, in-person engagement or interaction, if it's a completely digital or virtual platform, that can come with its own challenges, as many people may not be tech savvy. So while we do acknowledge that we need platforms that can facilitate friendships, partnership, but we also have to think that how these platforms would look like. But overall, in principle, these are some of the things that we focus and we keep in mind going forward from the lens of policy or from the lens of legal framework. This will work towards making the life of older queer people much more happier and safer. Last couple of slides. One is on challenges and limitation. So we acknowledge that it was difficult to reach out to people while ensuring diversity. So we wanted to reach out to people from different parts of the country, people who have different level of education, people who identify with different faith and have other kinds of identities. So ensuring that diversity was difficult in the time frame that we had, but we tried our best. We also acknowledge that this is a small study. It's 20 people whom we interviewed, so there is a good chance that our findings do not represent every experience or every story that is out there. So we acknowledge that. Going forward, what we project team would want to do next, so we want to take findings from this study and go a bit further and explore how it actually ties into health related decision making, palliative care, and end of life care for older adults from the queer community. We'd also want to know explore kinship for the age groups that we did not include in this study. So here we focused on 50 and above, but we may want to know that for people who are 40 above or people who are in younger age group, what does kinship look like, and does it play the same role what it plays for people who are 50 above? Uh, in the light of what we spoke and what we highlighted, we'll develop policy brief and we plan to share it with relevant ministries. And we'd also work towards an academic output so we are able to contribute to the literature from our finding. So vote of thanks we'll save for later, but this was our presentation. I invite any question, comment, suggestion from anybody. You could use chat, or if you want to speak, you can perhaps raise your hand and then we'll invite you. Maybe while we await from, I mean, we're waiting for people to share their comments. I can invite few remarks. So Chaynika is here with us. Chaynika, I'm sure a lot of you know, is a writer, researcher, activist, and a leader within the community. So Chaynika, you want to share any remarks? Do you want to share any thoughts from your end? We'll appreciate that while we wait for questions and comments from others.
Thanks, Alec. And thank you, the team, for what you've done. Um, it's been a tough job. I have been witness to it. I think one of the challenges for people who are considered older is that you cannot find them. You cannot really find them because they're not visible in the same manner that younger people are today. And in a sense, then we kind of think of the queer trans communities as being very young. And there are multiple reasons for it. One, of course, being that in more recent times, there are people who are more assertive, vocal, visible in different ways. But also that there is a reality of how long can you sustain your queerness. And like you said, that some people get forced into marriage, some people move into heteronormative relationships of different kinds, or move into invisible spaces, even within the queer spaces. So you become invisibilized multiply, not only by society as such, but by the queer communities themselves, queer and trans communities themselves. And what we've also realized over the years is that very few of us actually who come from more marginalized backgrounds manage to reach the age that we are considering is old enough. That is plus 50. That's actually being that age itself is something that we found a lot of our younger friends not survive till that age. And so aging is has to be recalibrated when we look at different lives. And when we look at queer and trans lives, then what we realize is that one has to understand aging itself differently. We cannot use the usual markers of aging. We cannot use the usual age markers and the social markers. And so we are also in the process of understanding how do we look at aging. As much as you're looking at kinship and you're looking at what are the other ways in which one can understand from people's lives what is required or what could make life easier for them. So I think that one of the things that I can hear as I listen to your findings is also that there's this thing of at what point does your family when is the family important for you and when do you become important for the family, and what is the transition and what does it do to your relationship to this assigned family or the family where you are born and brought up and belong to. At the same time, the complex manners in which people even live their marriages, heterosexual, cis heterosexual marriages, and sustained queer relationships within that is something that probably you haven't been able to capture in the study that you've done. But that's another angle altogether, which if we go looking for queer people, then maybe we don't find that. That there are multiple ways of being queer while appearing to be heteronormative in other ways. So what I'm saying is that there is invisibility at so many levels, that there is invisibilization at so many levels that we ourselves fail to see it many times. And so in that sense, starting with this small study, starting with this um, maybe a very handpicked group of people who I know how difficult it was for you to find even these 20 people. And especially since you put your bar as a higher age, it was difficult to find. It's also a reluctance to speak. It's also a reluctance to acknowledge that I am the elder and I'm the senior and I need to talk about my life. It's also probably facing a lot of questions that you might be running away from. And if I have, so for example, if I speak from my own experience, if I have my children, if I have somebody that I'm considering, if I'm looking at the usual markers that my friends have, I don't have them in my life. I find that my friendships also go across age groups. And my friends who are in more heteronormative families, they generally then, because they have children and those children have younger friends, that their friends become older. So my friends are older, whereas I don't have uh, any such limitation. And so in that sense, there is an interesting understanding for what does kinship mean for everybody that can emerge from looking at people who've been denied the usual kinship models. And I think that from this study also we can draw many of these things. I mean, you're saying that friends are very important. I think friends are important for many people, but we never reach that point of giving them importance, because in our understanding, the importance is only of the blood and marriage family. And so a lot of people who might be in married families, might be in heterosexual relationships, might also find friends very important and might also want to make them their chosen families. But because of the dominance of this heteronormative structure, that maybe they are not able to articulate it. So I also see these understandings of kinship that are emerging from even small studies like this, opening out ways of becoming older, ways of making fulfilling kin, kin relations with different kinds of people for many other people as well. And so I really appreciate the fact that, you've managed to capture this aspect of what does kinship mean for this very small section. And as you rightly said, it obviously does not indicate what it means for many other people. And there's a lot more that one could go into and study. But to reduce it to urban lives, to reduce it to a certain set of population, yes, within that it becomes representative. And I think that for this age group, a lot of us are also connected because of we were the only few that were known, that were out in some ways, and so knew others who were out like us. And so naturally, our circles are more around activism. A later generation, maybe 20 years later, may not be connected to each other through activism. And their lives and their friendships and their kinships will totally evolve in a different manner. So, this particular group that we're looking at, urban queer people who you can track today, would be connected to some sort of activism. And it kind of also highlights the fact that those who found the space, courage, whatever you want to call it, those who found the ability um, to be out in different ways and to actually tread certain paths that were not trodden upon, have found each other in the process and have found activism as a space. And whether that when you don't need that space also, can that be a space that can become a space for community building? So I am saying that there are lessons that need to be taken even from these restrictive samples, which will help other people understand the different ways in which communities can be made. So with this I shall pause here.
Thank you very much, Shainika. I think that was quite insightful, and all the suggestions that you shared with regards to how we can further look into what we have and capture some of the points that you suggested. I think we'll surely do that. There are some comments, questions in the chat, so we'll respond to them. But I'd also like to invite remarks from another friend of ours, Ritash. Ritash is a writer and also a peer support counselor. And Ritash has also been very supportive to us as we were approaching this study. So, Ritash, over to you.
Thank you very much, Salik and everyone else at Sangat. Some of us had friends who have known each other for a few years or longer. And even I see so many other familiar names. It was wonderful hearing Chayan. So thank you also for inviting me to participate and acknowledging, whatever little I could do. Um, uh, one, a few things which stood out for me, first of all, about this very unique survey. Yes, I agree, like all surveys, studies, researches, there are some limitations, which I think, I'm saying Salik because I interacted more with them. But having said that, the first thing is the immense sensitivity and care, which I think, it was a big advantage that, a queer person only was contacting me, because despite their best efforts, I have seen that more and more people who are straight or not queer, who approach us for studies and researches, somewhere somehow it's become slightly soulless and very overly clinical. So that was not there here, which is why I openly and relentlessly advocate that queer people should tell our stories or facilitate it for others, other queers, and also do these studies and researches. And the other thing is that also, which is why also I was confident enough to refer other people for the study. And one of those participants, who's I'm 50 and a half or 50 and a three quarter now, but that person is in their 70s, and also, was very happy that I referred them. So, and then, more important that like even such a study is being done. And the other thing is, which I found about this is, that it was not just about taking feedback. Yeah, it was not about, asking questions and stuff like that. It was a wonderful set of conversations which we had. Yeah. So because just like I saw in the comments just now, yeah, there's always this. Yes, obviously there will be the so-called urban English speaking queer people who will sort of take the space everywhere, unfortunately, despite trying not to. There's also these age gaps, and somehow this maybe on one side, some time back I was on so-called the other side, or there were no sides to take in terms of age, but now it is almost here to stay, that the younger queers will say, oh, we're the younger ones, we are not getting voices and stuff like that. And I'm not generalizing, but I think partly taking from what Chayan said, uh, sometimes we older queers or sometimes reluctantly we accept this, or somewhere we get labeled, but maybe for a reason, okay. And such things should continue, but establishing what we call support and socializing groups, like not necessarily too much socializing, but whatever we want to call it, just like some kind of a cool hangout groups for queers over 40 or whatever. Even starting them is very difficult. I'm trying to, but people will be like, yeah, 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 it's required. But yeah, so I think if people here take the hint, yeah, so that's the thing. And so all I'm saying is, I'm not sure, Salik, if I said this in one of our conversations. I always believe, identity no bar, sirf ishq bar bar, jo bhi hai wo ishq. Yeah, so I will end with that. But thank you again. And it's been wonderful, not only being part of this and so many other things that Sangat does, but also listening, and glad to even hear that such a thing has happened. And slowly but surely, I think the current generation of queer folks, some of whom seem over-connected, yeah, uh, are actually finding that there is so-called aging or aged queers, whatever that might mean. Yeah, and I'm part of many groups where like the age gap is wide, but anyway, it's good learning and all that, right? So thanks again, and hope to spread more queer joy. Thank you.
Thank you very much, Ritash. Glad you could join. I'm gonna respond to few of the comments from the chat. Excuse me. Um, how do you ensure psychological safety of participants during the interviews? So there's a couple of things one can do. One is to have a lot of conversation before the interview and give them the orientation about what the conversation in the interview is going to be like. Who are we? Why are we doing this study? So that they are convinced. Sharing the questions in advance, I think that is very helpful, so that people know what is it that we will be asking them during the interview. I mean, reiterating again and again that people have choice to not answer anything that they do not want to, that they can leave the interview at any point that they want to, that we can have the interview at any day and time that is of their convenience, that we can have the interview in any mode which is convenient to them, such as telephone or over Zoom, etc. And another thing which is very helpful is taking feedback after the interview. That was this interview a good experience for you? Are there things that you suggest we should reword, reframe, exclude in subsequent interviews? So these are some of the things that one can do to help ensure that the interview is in a safe space. Thank you very much, Pankaj. Angela, I think that's a fascinating question. I think you're referring to one's perception or anxieties or fear associated with aging and how it actually, I mean, when you arrive at that age, how it is for you. This was not the focus in our study. We did not have any question that was asking that when you were, say, 20, what did you think of life would be like when you would be 40 or 60? But I think that's a very interesting area to look into. But I do remember one participant saying that when they were younger, they were indifferent to what or to how things would be like when they are 60 or 70. And they also shared that for that reason, they don't hold it against the other younger people who are in their 20s or 30s who are indifferent to older people. So that is one thing that they share. But this is a very interesting area to probe more. Um, Anita, I think your point, identity, I think maybe I can request Gauri to share that slide that has breakup of the identities, but we have not looked at the relationship as you described, whether financial, I mean, to what extent the fact that one is financially independent or financially dependent ties into um, the relationship that they have with their family or with their kinship system. I think we haven't gone quite a bit deep into that, but we did ask in the demographic from all the participants how would they describe their economic status. So this is something that we can go back to the data that we have and look into it and come back and perhaps include it in our paper as well. So this is what I can say at the moment. Um, I'm gonna pause here. Gauri, if you want to add anything or take any of the questions, then I'll come back to other questions.
Thanks, Alik. Yeah, I could add on the question that Shreyas asked also. So, other than everything you'd mentioned, we'd also, in one case, stopped the interview halfway when somebody was experiencing distress, and only if they were okay with it, reschedule it at a later date, as well as connecting them to support groups within their city, um, on their request, to be connected to queer support groups as well. So beyond study, beyond things that we can do within the study, and as a research team also, extending that to, like, connecting them to other community members. Yeah, that's one thing that I could think of adding, but I think you covered the other two questions quite well. Yes, I agree that we can look at um, the question that Anita asked about, how might economic status relate to some of our findings, is definitely worth looking into again. Yeah.
Um, uh, I have two comments for Vinita's question. Forging legal recognition, for example, co-owning bank account or passing on inheritance to capture legitimacy of such kinship. The answer is no. We did not find it in our study. Nobody explicitly mentioned that. But there are 2 points that come to mind that sort of relate to the area that you are touching. It does not directly relate to your point, but it is in that. I mean, it is sort of indirectly related. One is that we did have one participant who said that they are in love with a much younger person and they wanted to pass on their house to this person, but they were not sure how it might happen in the current legal framework. And they said, one way could be that I might as well just adopt this person. So on paper, they would become my son, or they would become my child, and then I'll be able to pass on the property, whereas in actuality, they are a romantic partner. The other thing, what happens is that a lot of our participants have expressed fear that people may be approaching them or wanting to have a relationship with them because they want access to certain wealth, because they want access to uh, certain other kinds of privileges and so on. So that fear was something that was shared as well. So these are 2 points that come to mind here.
I could add one more thing also to Vinita's question. Not so much for platonic relationship, but one person for signing consent documents on medical records did express that when their partner had to undergo a surgery, they crossed out all the categories on the form and wrote partner and kind of um, um, explained to the hospital staff that they would be signing for on the behalf of their partner and kind of navigating a medical situation in that way. So that's one thing that I could add. There was also a question um, in response to Shreyas. I don't nobody identified themselves as polyamorous in our study. But I think that again, like um, relationships that are not strictly monogamous or fall within a specific structure might.
Yes, Ritash, you wanted to add.
No, just wanted to say that I identify as poly. Maybe I don't reveal it always, but since Shreyas asked that question, I specifically put my entire identity details, and anyone wants to reach me because the other thing which I also do is I am a research advisor for one MPH candidate and one PhD candidate. So anyone else wants any inputs or, and since I write also extensively, yeah, that's why I've given my details. These are not for dating or hooking up or anything. Okay, yeah. I mean, not that there's anything right or wrong or good or bad about that, but I don't want it to be misinterpreted. Yeah, so that's why I wanted to say thank you.
Thank you, Ritash, for pointing that out and for correcting us. Yes, Priyanka, I think it's a great area to look into. I personally am very interested when it comes to accessibility to family building reproductive health services. So whether it's IVF, whether it's adoption, etc., you can make your research much more focused, whether it's any particular domain of healthcare, whether it's particular kind of healthcare setup such as government, private, whether it's particular context such as emergencies, pandemic, whether it's particular identities that you want to focus, geographical focus. So you can make it more focused that way. Yeah, Arundhati, yeah, please go ahead.
Yes, hi, hello everyone. First of all, thank you so much for such an insightful research in the first place. I am also a researcher. I have currently this month I have moved to Japan, and I am researching on immigrants and queer kinship basically. So basically the kinship networks that queer immigrants form in Japan. So when I came across this discussion, I was really excited to find out how it has worked in an Indian context, and I'm really glad to see that you could manage to do whatever you have done, because although I have just started, I do understand the limitations in the sense of like finding people to talk to, making sure that you are not approaching people just to just as like research subjects, but also humanize them enough in your findings. So first of all, congratulations to all of you for being able to manage to do that. And also I had just a comment, not really a question, but it's really interesting to me because it was just pointed out about how you shared that little incident about about the person who said that they were considering if they could just adopt the younger partner to pass on the house to them. I just wanted to suggest if you wanted to look into. So Japan has a system which is called the Kuseki system. Basically, the way that we are registered with our birth certificates back in India, like when we have birth certificates of our own, sort of. So Japan has this system when you are registered as a part of your family of origin, separately in addition to your birth certificate, which they call the Koseki system. And because Japan also does not have, like, same-sex marriage is not legalized here as well. So this is a very, very common thing that happens within the queer community. There has been literature on it as well, that the older partner adopts the younger partner in order to share a house, in order to live a life with them. So it's very interesting to me to find out that you also found something like that, even if it might have been mentioned in passing. But that really also shows how so many queer experiences also, like, just are similar even in very, very different contexts. So yeah, I just wanted to share that as well. And if you're interested into looking into it ever, you can just like look up. So yeah, that's all I have to say. Thanks once again. It was a really, really insightful conversation.
That was fascinating. Thank you so much, Arundhati, for sharing that. I think we'll surely look into it. Pankaj, yes, we do different kinds of work that includes queer and trans community, and one of them is research. And we are a new group. We have been working for the last 2 to 3 years. And yeah, at any given point, we do have one or two projects ongoing that are focused on queer and trans communities and that are research projects. So the answer is yes. We have been doing that on an ongoing basis. So we can proceed with vote of thanks, and we will also like to have a photograph with all of you. So if you're willing and if you have the internet bandwidth, if you're comfortable, do turn your video on briefly, and we'll be capturing your picture. All of our picture together. If there are any more remarks, if anybody else wants to add anything, I'll maybe just wait for 30 seconds and then we can proceed with vote of thanks. Arundhati, did you just raise your hand again, or is it from the previous time?
No, no, it's from the previous time.
Okay, all right. So while we are all turning on the videos, I want to thank the organization Sangat for providing us with this platform. Our group, I hear, our colleagues at I hear, our team members, we mentioned all of them in the presentation, the admin and the finance team that we have at Sangat. A lot of any project involves admin and finance work. Our CAB members, for being so helpful, and all our research participants as well for agreeing to share their stories with us. Gauri, if I have missed anyone, you may add.
Yeah, I'd also like to thank our volunteers from I Hear who helped us with a lot of the transcription work. So, but yeah, you covered everybody else. Thanks.
All right. So I don't think we all fit on one screen, so I have to do it twice. I'll give a cue, but I'll have to do it 2 times, and then we'll get the picture. So 3, 2, 1, and smile. Okay, that's one. Saved. And let's do it once more. 3, 2, 1, and smile again. Done. Thank you so much for being a wonderful audience, wonderful questions, lot of interesting insight and areas to look into. I wish you all a very happy weekend, and hopefully we'll meet and chat someday at some point. Thank you. Goodbye.